Adherence is the course of treatment, making sure that the patient takes the treatment as long as needed. You need to help the patient understand the disease well and feel they can live with the disease. Whatever it takes to help the patient continue treatment and get proper medical follow-up is what we will be doing.
Hello and welcome to the 5th episode of Health Access Now, where we explore innovative solutions to address access to healthcare challenges. In previous episodes, we spoke to Dr. Joseph Saba, CEO of Axios, about his life journey, the evolution of access to healthcare, and his dealings during the HIV and AIDS epidemic. Dr. Saba is here with me again, and today we're going to tackle the issue of patient adherence. Patient compliance or adherence describes the degree at which a patient correctly follows their medical advice. There are many reasons why a patient might not follow their treatment plan, and in the next 30 minutes we're going to talk to Dr. Saba about why it's essential to support patients throughout their journey, even after they leave the hospital. Hi Doctor, and welcome back to Health Access Now, episode 5. In our previous episode, we spoke about one of the big gaps that patients are facing outside of a hospital, which is the referral process. And today we're going to address the other big issue, which is adherence. I think it's a subject that has been growing in importance in recent years as more research comes out that there is a pervasiveness of poor adherence to appropriately prescribed medications. Can you tell me why this is such an important issue that we can't ignore?
Well, it's an important issue because people have to take the medicine for a long time. And this started, we talked before about the Drug Access Initiative and access to antiretrovirals and the fact that antiretrovirals had turned HIV into chronic disease because they needed to be taken practically for life. So even at that time when we started Drug Access Initiative, one of the issues was, how do we make sure that the patients take the medicine for a long time and they don't stop the medicine when they feel better? And that's common trend. And the systems were not equipped for that. I mean, patient comes, they get medication, they go, and nobody knows what happens until they come back. This has been a major issue for HIV, and, it was handled sometimes in parallel systems. But now, with cancer, with chronic diseases, we have the same problem, and this problem is for a long time. We don't know what happens to the patient outside the hospital, and we need to understand what are the factors that make the patient stop the treatment. One common I just mentioned is that they feel better, so they stop, but others could be apprehension about the medicine, could be they heard the neighbor say something wrong about the product, could be many, many things. And now I think not only us, but even the WHO issued guidelines about what are the factors that could influence adherence. So there is real emphasis on adherence these days to improve the medical outcome of the patients.
Okay. And so two words that I've heard, I suppose, used interchangeably, not so much in Axios, but outside of Axios, is adherence and compliance. Can you tell me what the difference is between the two?
Adherence is the course of treatment, making sure that the patient takes the treatment as long as needed. Compliance is, I would say, a more scientific measure. We need to make sure if you take one pill a day, you need to take 30 pills in 30 days. You don't take 27, So it is linked to how much you take every day. And that is what compliance is about. So we try to measure that, and we try to encourage the patients not to stop treatment or forget pills or things like that, and also with guidelines what to do if it happens. But that is compliance. In the end, if you need one box per month, at the end of the year, you need to get 12 boxes. If you consumed only 11, it means you missed treatment somehow. And in some cases, this would be suboptimal outcome. So compliance is very important, but adherence is also important. We need to make sure that you get your exams, that you renew your prescription, at the physician on time. Very often that's what happens. You say, come in 3 months, and we take 3 months treatment, and then the doctor is busy. So you go on 4 months later, and that's 1 month missing. So this is also part of the adherence. So duration of treatment becomes very
So what are
important.
some of the issues that might influence adherence? I mean, you mentioned earlier on that, maybe it's just that they didn't reach a doctor in a month. Is there anything else that could be an influencer in terms of adherence?
Yeah, WHO issued 5 major ones, I would say, areas that could influence adherence. One is understanding the disease, is understanding a little bit the implication, the fear from the medication. Understanding the medication becomes very important because people are afraid of the medication, they are afraid of adverse event. There are also social influences, is when people see in the community that something's happening because of the product, rightly or wrongly, because
Misinformation.
sometimes it could be
Yeah.
just a rumor or misinformation. But still, I mean, they apprehend what happens. So social factors are important. There are economic factors also, and there are 5 big dimensions that they identify, but they really are very broad. The key question to be able to work with the patients is to know, well, which one is the one that matters to you as a patient, and how do
So
we
how do we
address it?
do that then? How do we use those 5 pillars, I suppose, or 5 areas to create
Yes.
individualized adherence mechanisms to support chronic medication users?
Well, we developed a tool which is basically a questionnaire that is inspired from the 5 pillars, where that we ask the patient to identify what are the risk factors, what are the areas that bother the patient. And then once we identify the areas that will increase the risk of the patient to stop the medication, then we start working with the patient. We discuss with them, sometimes if it's related to information, if it's related to misinformation, it may be related to the fact that they apprehend maybe a test or an exam, helping them through this exam. Sometimes they just need a physiotherapist because they feel that the product makes them feel tired. So we will need to address basically what bothers the patient to help the patient address the disease, understand the disease well, and feel they can manage their life they can live with the disease and live with the treatment. And that's really what drives us. And it works. And of course, it needs follow-up throughout the treatment duration to ensure the
Yeah,
optimal
and I'm
medical
sure those
outcome.
influencing factors might change, right? So somebody might be very happy to stay on a medication. You think they're fine. They leave the
Yes,
hospitals, everything's okay. And then 2 months later, a rumor comes out about a medicine, or like we see it with the vaccination now. Somebody knows somebody who had an
of
adverse
course.
event, and all of a sudden you don't want to take your medicine anymore. And without kind of being in touch with the patient or have that continuous communication, you don't know, right? They just stop their treatment, they don't go back to hospital, and then they end up sicker potentially.
So absolutely. There is, I mean, in the beginning, there is an assessment, and then based on that, there is an action plan. But that action plan that we work with the patient on may change based on the patient perception or patient fears, or sometimes
Yeah,
adverse events even
true.
happen to patient, real adverse events. And then
Yeah,
you
and I
need also
suppose,
to
as you're
manage
saying,
that.
there's an adverse
So,
event. Say if a patient is not going to a hospital every 3 months or every 4 months, and something happens when they leave the hospital on day 2 or day 3, 4 months later, they're going to be less likely to report that to their physician, right? Because they've forgotten, and it doesn't seem like a big issue for them anymore. Whereas if you have somebody recording it, it's more beneficial,
exactly.
and they
And
may
they
even
may
not come
even
back.
not come back
Yeah.
because they got that and they decide, okay, I'm going to
Okay.
try
So we
something
spoke a
else.
little bit around digital in our last episode, but do you think digital can help in this scenario when it comes to adherence?
Oh yeah, oh yeah, definitely, definitely. We have our own system related to that for adherence, but for also for affordability. First, it allows you large scale
Yeah.
follow-up of patients. What we found, also we published it. The article was published recently. What we found is that human touch
Yeah.
remains important. Just doing digital will not be enough because it doesn't help people when they are really apprehensive or they have adverse events or or they really are having trouble with the medication. But for day to day, for organizing the follow up, for organizing the exams, of course, the digital will help and has helped us a lot in scaling
Yeah.
up these programs. But you still need to keep
Yeah, I've heard
human
someone
touch
I've
in
heard
the
someone recently
difficult
describe
times.
at Axios describe it as almost like a 21st century stethoscope. You know, it's just another tool that the doctor has or we have that can help with patients. It's never going to be a replacement. You
Yeah.
know, it won't do the job of the doctor, which is just interesting. Yeah,
Absolutely. It won't do the job of the doctor,
and we
and
don't
we don't
obviously.
want to
Yeah.
do the job of the doctor. And that was one of the things that I told the team when we discussed adherence, and they told me we want to do this and that, and say, wait a second, you don't do my job as a doctor, but I know
Yeah.
that I don't have the time to do it all. So you need to help me do a bit of it, and I do it. So that's why in our programs we
Yeah.
continuously communicate with the doctors and with the patients and make sure that in the end these relationships are fluid, and when the patient is in trouble or is really having difficulties, that someone address these difficulties. Sometimes it's the doctor,
So,
sometimes
I
it's
mean,
us.
around that, then, is it possible to assess proper adherence? And if so, how do you do it?
Oh yes, yeah. The key one, it's very simple,
Okay.
is duration of treatment. How long is the patient on treatment compared to patients who don't have adherence programs? And this is how we started. When we did our affordability programs in Axios, and even before I told you about the Drug Access Initiative and antiretrovirals. So we knew that even if we're trying to address the affordability of patients, we need to make sure we follow them so that in the end, they get the proper treatment,
Yeah.
the full duration of treatment. So we did integrate that in our programs. Then we have the clients who came and said, but I mean, for the patients who don't have affordability program because they are reimbursed or they are covered, the treatment
Oh wow.
duration is much less. Why is that? And we say, well, because it's an adherence problem, because
Yeah.
we're following our patient. And that's how we really start. And I'm talking about doubling the duration of treatment. It wasn't about saying, oh, well, it's 2 weeks more. It's really double. And that's what triggered us say, okay, well, let's move into adherence, even if there are no affordability
It's really
issues.
interesting. So I understand that there are adverse effects of non-adherence to medical outcomes. Can you tell me some examples of this? So if somebody's not taking their medication properly, there's going to have it's going to have an impact on their medical outcome, right?
Well, I mean, if you have tuberculosis and you're taking anti-tuberculosis treatment and you stop, you're going to relapse your tuberculosis. If you have a cancer and you're supposed to take a cancer treatment that supposedly stabilizes your disease, you're going to relapse. You're going to go into disease progression. If you have, rheumatoid arthritis and you don't take your treatment, you're going to feel worse. So in the end, I mean, the medical outcome is not achieved. And by the time you identify that as a patient, very often it's
Yeah.
very late. And that's why for us it's going to be very important to keep that medical outcome. So in the end, keeping the medical outcome means everybody's happy. The doctor is happy because finally their prescription has led to the medical outcome they hoped. The patient is happy because now they feel much better. The pharmaceutical companies are happy because now there is evidence that their
Yeah.
product is actually working. It's not saying that it's not working. They say, yeah, but maybe the patient didn't take it properly and all of that. And we're happy because in the end we achieved
Better
the
medical
ultimate
outcomes for the
medical
patient.
outcome.
Yeah. So can you tell me then, based on that, what are some of the adherence strategies that we implement at Axios?
Well, looking at the strategies we look at the disease area, we look at the treatment. We focus on treatment. We are about access to medicine. We are about access to treatment. So we believe firmly that unless you have treatment, it's very
Yeah.
difficult to address a disease. And the treatment could be the
True.
vaccine as well. Could be some intervention that actually
Yeah.
changes medical outcome of the patient. That's what's important. And so if we have treatment, then we look at the disease area, we look at the implication of the treatment, the implication of the disease, and we work together with the doctors initially about what would be the strategy for that disease area. And then we work also with the companies based on their treatment, what is needed, and we implement this program. And sometimes, as I said, sometimes it's physiotherapy for the patients if they have, rheumatoid arthritis. Sometimes it's psychological treatment, psychological support. Sometimes it's neurologic support. Sometimes it is support related to PET scan and making a number of exams to ensure whatever it takes to help the patient continue treatment and get proper medical follow-up is what we will be doing, and that strategy will differ by disease area.
So that's brought me to the last question, and you touched on it a little bit earlier on, but when adherence measures are really effective, what are the benefits? I mean, I think it's obvious, it's clear what the benefits are to the patients because they have better medical outcomes and they live better, healthier lives. But in terms of the other stakeholders, what are the benefits?
Well, as a doctor, I want, when I prescribe my medicine, I want to make sure that the patient gets it and the patient comes back and say, I feel better, I'm much better now, and that the patient is at least stabilized or cured depending on the disease area. So I'll be happy. For me, it's ultimate also medical outcome. For the company for the companies, there are different aspects. First is the patient, like the treatment works, and all the companies want to know and be able to say that their treatment works, that their treatment duration is optimal. So this is also a benefit for the company. So as I said, in the end, it's a win-win for everybody.
Even from a patient's family or their carer's perspective, like if they're more empowered to be part of that, their treatment planning, and they know they're being cared for outside of a hospital, they have more time to speak to a medical person, to ask advice. It's just a no-brainer, right? So it has a knock-on, even from mental health perspective, effect on everyone.
Yes. And even from a payer perspective, I mean, you don't want to be paying for a treatment that doesn't work. And now we have many payers are saying, I want to pay based on the medical outcome, because some treatments may work in some patients and may not work with others. And if they're expensive, they say, okay, I'll pay for what works. So in the end, everybody wants to pay for what it works. And having a patient, for example, take 3-4 months medicine that costs thousands of dollars, and in the end stop it and doesn't reach medical outcome, then what's the point? I mean, it's a waste of money, whether it's payer or whether it's coming from the pocket of the patient. It's a waste of money. The doctor is not happy because it didn't work. The company is not happy because the reputation of the product is not good. Everybody loses with it, and including the payers. So the payers are very peculiar about it, and they're always happy when they see that in the end.
So you mentioned just there that they're potentially what's working for one patient might not necessarily work for the other patient. Could that be, I mean, as medication becomes more sophisticated and, the method of taking it, the time of taking it, what they've eaten, all of those things, could they influence it? And can adherence, I suppose, mechanisms help that? Yeah.
They could, and they would influence that, yes, because you really want, especially if, whether you're the payer or the company, you want to make sure that in the end, the treatment is taken in an optimal way, so that if it has the best chance to work, and if it doesn't work, it doesn't work for the right reason. Not for a good reason, but for the right reason, and everybody wants to know that. So you'd better make sure that the treatment is being taken properly.
It makes sense. And as I said, that brought me to my last question. So we'll finish up by saying thank you again for sharing your insights. I love talking to you. You're always so interesting. And I know our viewers are really enjoying the conversation. So thank you again for your time today, Doctor. We'll talk again soon. Bye-bye.
Thank you, Emma. Thank you.
So thank you again, Dr. Saba, and a big thank you to our viewers and listeners who are supporting us in this mission. If you have a question that you would like me to ask Dr. Saba, feel free to write to us and I'll make sure to pass it on to him. In the next episode of Health Access Now, we are going to explore how health access solutions can help rare disease patients. So do stay with us, subscribe to our channel and follow us on our journey into the world of access to healthcare.